Encouraging signs of improvement today in the condition of Bryan Stow. Now, he is the Giants fan that was beaten outside of Dodger Stadium on opening day. Doctors at San Francisco General Hospital today say he is breathing without a ventilator and has, at times, been able to respond to simple commands. His condition has now been upgraded from critical to serious. This is something we certainly want to talk about further, and to help us understand what this all means, we have with us today, the doctor's in the house, neurosurgeon Dr. Todd Gravori from Northridge Hospital. Doctor, thank you for joining us. First of all, the idea that Bryan Stow's condition has been upgraded, just how positive of a sign is this? How cautious should we still be?
We should be very cautious about what they're telling us because his condition has improved. Part of it is because some of the medication that we use to improve the condition and keep the brain swelling down has been worn off, so he's sort of waking up. But some of the brain functions are coming back, and because of that, it's a major improvement, although we have to be hopeful cautiously because we don't know how far it's going to go.
And let's talk about the injuries to this man. We have a prop here that you brought with us. Okay, yes. Now explain what the doctors did and what's next.
Right. So after the injury, the brain starts swelling up.
Okay.
And in order for the brain to swell up beyond the skull, what we need to do is remove a part of the bone, actually, very much like this one.
And with Bryan Stow, they removed a larger portion.
Most likely.
Okay.
And it would be on the left side, of course, which is the dominant hemisphere. And so the brain swells up beyond this point, and then we put the patient on medication, and after the swelling goes down with time and some treatment, then after about 3 to 6 months, we put this back, if it's available.
Okay, and you put this back, and then it's just a wait and see until we can get him into rehab?
That's correct. That would be the next step, and it depends how far and how well and quickly he recovers, where he can participate in rehabilitation.
He's nowhere near that now, but that would be what they would hope that they could accomplish. When we talk about the recovery process, is it possible that Bryan Stow could once again return to leading a normal life?
Although I don't know the specifics of his injury, because obviously I haven't seen the scans, but it is possible. Because right now he's moving his left side, which is controlled by the right side brain. The left side is the injured part, and we have to see how that recovers.
And when you have the situation with his recovery, what are the possible setbacks that we have to watch out for right now?
Well, during this long period of recovery, he could have infections, he could have more swelling in his brain. There may be some damages to the brain that we haven't really seen because the brain is still under a lot of pressure and also a lot of stress. So really we have to look at his clinical picture and see where he goes. He could have change in his personality, weakness on one side, or also difficulty speaking.
And Dr. Gravori, then just to break this down for me, ultimately if we took this in steps, what would be the next step in terms of motor skills? Would he be able to speak? Would he be able to say certain things? How would we go about watching this recovery take place?
Most likely, first we'd be looking for movement on the right side, because that would be probably the first thing that would come back. And then slowly, it's a great thing that he's following command, because that means that his language skills and that part of brain in charge of language is coming back. So hopefully he'll be able to communicate at some point.
All right. Dr. Todd Gravori, Northridge Hospital, thank you very much for joining us. I hope you come back and see us when we have another update, a positive update.
Thank you very much,
on
Robert.
Bryan Stow's condition. Again, thank you, sir.